My name is Matthew Musgrave. I'm a government relations specialist at Heart and Stroke. We're a leading funder in life-saving research in Canada, focusing, of course, on heart disease and stroke. We've led to a number of important breakthroughs in heart transplant surgeries and revolutionary stroke treatments. That's one part of our work is on the life-saving research part. And the other part, of course, is on advocating for the policies that will inevitably make Canadians a little bit healthier. So I think one of the biggest issues that we need to focus on in the recovery stage of this pandemic is really on making the Canadian healthcare system more resilient. So I'll give a couple of examples. The first thing is on access to affordable medications. So prior to the pandemic, about 7.5 million people in Canada didn't have adequate access to the medications that they need to manage chronic conditions like heart disease. But it really kind of spreads through all the disease categories, which makes it really frightening because people are making really difficult decisions in this country between paying rent, putting food on the table for their families, and taking the medications that they need to manage their conditions. And when the pandemic struck, about 3 million people lost their jobs, and that added to the issue because more people also lost their access to the private benefits that they rely on. And that just wasn't just the workers, that was their families, that was their kids. So a lot of people lost their jobs, lost their benefits, and made it much more difficult for them to afford the medications that they need in order to live a healthy life. So there's kind of three kind of main focuses that I think we're really hoping that the government will move on, starting with this budget. I think first and foremost, it's time to implement a universal pharmacare program in Canada. As I mentioned, it's been a long time commitment of governments to make this happen. The pandemic has really demonstrated that this patchwork of 100 public drug plans at the provincial level and 100,000 private drug plans through all of Canada's various employers, it's just not covering people at a time when they really need it. When people lose their jobs, they lose access to their ability to afford medications even further. And that's just not an acceptable outcome in this country. And Canada remains the only country with a public healthcare system that doesn't have a pharmacare program. So that's something that we really need to focus on going forward. And we can take tangible steps now towards making that a possibility.